Hey, my medical marvels. Today, I want to talk about the difference between primary prevention and tertiary prevention. People don't understand the difference between these two. You probably never even heard about it, but it's actually very simple, and it's basically the thing that I want to do on this page because in medicine, we don't focus on primary prevention. We usually focus on secondary or tertiary intervention. So, primary prevention is the things that you can do now, stuff that you can do in your home to take care of yourself and be the healthiest version of you. If you focus on primary prevention, this will, in the latter, really prevent you from being in the hospital for really sick diseases when you are an adult. Primary prevention is all about just taking care of yourself. So, diet, exercise, sleep, positive relationships, being kind to yourself, also like getting vaccinations, just all those things that are just protecting you and taking care of yourself day in and day out. Secondary intervention are things that you can do to prevent a really bad illness. So it goes a little bit more in depth. It starts to get more into medical practices, what hospitals could, and other primary care facilities can bill you for. So, going to get treated for a common cold or going to get your mammograms or colonoscopies, things that you do to test yourself for cancer, and just kind of being on the ball when it comes to a certain routine to make sure that you're not getting really sick in the long run. And tertiary care is when you are already really sick and you are in the hospital to be treated for an array of ailments. This could be heart disease, diabetes, kidney failure, stage 4 cancer, stuff that you're in the hospital for surgery or for very serious medical intervention. So what I want to talk about is the healthcare system and why people don't talk about primary care as much. Primary care doesn't make money. Primary care is what you do for yourself without having to spend a dime on a doctor visit or a screening or medicine or being cured for cancer or going to surgery for, cardiac bypass. Primary prevention is about what you can do your best to take care of yourself now so you don't have to be flooded with medical bills and hospital bills in the long run. And the reason why I bring this up is because nobody talks about primary intervention. And, how do you educate people on primary care and how to help themselves so they don't get stuck at the hospital, sick, immobile, coughing up a lung, unable to breathe, tons of medical bills. In medicine, as nurses, as doctors, we are not trained to help people nearly as much in the primary intervention department. It's just not in our wheelhouse because, like I said, that's not how you make money in healthcare. So that's why I'm here. I am here because I have a very strong background in medicine. I've seen it all. I've seen the worst. I've been in the ICU in all different departments all around the country, Texas, Denver, California, Arizona. I was a travel nurse, New York City during COVID. I have seen the worst of the worst. And after all of that, we still haven't changed our practices in the hospital. And that is the worst part of making America not sick. We are continuing to make America sick. We have seen the worst, we've dealt with the worst, and we are not doing our best to prevent the worst. And if there were more people in medicine like me, just wanting to do their best for the public, wanting to just disseminate research that they've learned and how to gather those findings and disseminate research and bring it to the public in a few simple words, that's what we need in social media. That's what we need in healthcare. That's what we need all around, all across the fronts of medicine, because these are the things that people need to learn about that will prevent them from being so sick in such an early stage of their adult life. So primary prevention, that's what we're here for. We're here to talk about what you can do now to take care of yourself. Not to get confused with media, what's good, what's not good, not understanding the facts. I am here to disseminate the facts for you. We need more people like this, and I love it. I bring so much to my own life, and I just want to share it with all of you, okay? So thank you. Follow if you're into health. Follow if you're into just getting yourself a little bit more up and moving and better, and like simple tips and tricks that can be fun, not overwhelming, not break your bank, and just enjoy the ride.